Hello, Assalamu alaikum. My name is Dr. Ashik Hussain and I'm an assistant professor of anatomy at Brachialis Medical College. In this video, we will look at the cubital fossa. So, cubital fossa is a triangular depression in front of the elbow joint. So, here we can see that it has got lateral boundary, it has got medial boundary, it has got base, it has got apex and roof and floor. In a while, we will look at each in detail. So this is brachioradialis muscle. It actually forms the lateral boundary of the cubital fossa. So in other words, medial border of the brachioradialis muscle, it forms the medial boundary or lateral boundary of the cubital fossa. And here comes the muscle which is called pronator teres. This muscle is called pronator teres. So lateral border of the pronator teres muscle, it forms the medial boundary of the cubital fossa. So at this point where lateral boundary and medial boundary they are meeting each other, this is called apex of the cubital fossa. So it is a triangular depression or triangular in front of the elbow joint. Its apex is downwards, whereas its base is directed up above. So you will remove this bicep muscle just to look at the deeper structure. So here comes the brachialis muscle. So this brachialis muscle, it actually forms the floor of the cubital fossa. So again, lateral boundary is formed by the brachioradialis, medial boundary is formed by the pronator teres. Medial boundary is actually formed by all the common flexor muscles which arise from the common flexor tendon, but specifically it is formed by the pronator teres muscle. And brachialis, it actually forms the floor of the cubital fossa. Now after removing the brachialis, so base is formed by an imaginary line between the two epicondyles. So again, base is above, formed by imaginary line between medial and lateral epicondyle, whereas lateral boundary is formed by the brachioradialis, medial boundary is formed by the pronator teres muscle, and apex is formed by joining of the medial and lateral boundaries, and brachialis forms the floor of the cubital fossa. So the content of the cubital fossa from medial to lateral are MBBR. M for median nerve, B for bicep tendon, which I just removed in then brachial artery. Brachial artery is before the bicep. So median nerve, brachial artery, bicep tendon, and then radial nerve. So this was a brief about the cubital fossa. Thank you very much.